Hello and welcome to the Hooked on Health podcast. I'm your host, Dr. Sean Lordan, and today I've got a good friend with me, Dr. Adam Thomas.
Hello.
Hey, Adam.
What's up?
So I will let Adam introduce himself. We go a ways back. We graduated PT school together, and he's had a really tremendous career. And I just, from being a professor to working with professional sports teams. I'll let you go into the details, Adam. I'm really excited to have you on today.
Yeah, no, thanks for having me. When I was in high school, I really wanted to work in athletics, and I really wanted to play sports, and I just was terrible at them all. So I figured, what's the way I can get into it? So I went into athletic training, which I loved, and it was awesome. And I started getting into that. I actually got a job working minor league baseball for the Houston Astros for 3 years as an athletic trainer. It was great. I was not making great money, but the experience was unbelievable. But from there, I realized, my father was ill. I wanted to get back home. And I had a job at Merrimack College where I was they created a job. They had a job where it was 50% teaching, 50% in the athletic training room. I was like, this is great. I was there for almost a year, 364 days. And I got a job at Northeastern doing the same thing. So Northeastern created a job where I was half in the athletic training, I'm half teaching. And it was there where, I was teaching. I really enjoyed it. I started diving more into teaching where I was like almost 90% into there, but still in the clinic a bunch working with athletes. And I then got the ability to work PT. Like they're like, hey, you want to teach a lab? And I was like, sure. And it was at that point where it was two people that were very instrumental in me becoming a PT, which was Mary Hickey and Sue Lowe, who were former teachers that you had, and they were former teachers that I had and colleagues I worked with. And they'd say, hey, what do you think about getting your PT degree? I said, no, do it. And then it was at a time where I'm like, all right, let's do it. And I got it. And the funny thing was I think I had the class that I joined, I had for a foundations lab.
Yeah.
And then the next semester I'm in psychosocial aspects of healthcare, and it's like, what the heck? So that was the transition. That was awesome. I was fortunate to get with good people in the cohort that we were in it. So I got a PT degree, and I was like, that's it. No more school for me. No more tests. And I realized that was just the beginning. So from there, I kept teaching at Northeastern full-time. The PT program was awesome. At that point, I was working a lot of professional lacrosse and with the U.S. national team, which was great. I'm working as an AT and a PT, so it was kind of the best of both worlds. And then from there, I got a job at the Red Sox in 2015 and left academics. And that was a hard decision, harder than people think it was for me, because working in academics was awesome, teaching was great, and able to treat on the side was awesome. But it was a once in a lifetime opportunity. So to go to Major League Baseball and with the team I grew up rooting for, and for a team that's always going to try to win. And I was with them until the end of 2018 when we won the World Series. It was awesome. And I actually went to the Cubs for 1 year in 19, and then kind of knew I wanted to get back into teaching. And so I applied, interviewed back in Northeastern in 2019 and started working back there. And at that point, I was back into pro lacrosse because it was easy. It was on the weekends. But then I ended up getting a job in professional rugby, doing the Free Jacks 2022, and been with them for the last 4 years. So it's been great for me. I went from Northeastern to Johnson & Wales University, where I was there for a year and a half and ended up being the interim program director for a little bit. And now I'm at a hybrid program in Orlando South College. And just started that. It's different working from home and working in a hybrid program, but it's interesting, and it allows me to still do my clinic work with the rugby team. So yeah, I'm fortunate. I've had some good experiences along the way, and I'm proud of it.
Yeah, so this is the PT's PT podcast, and so really it's for newer younger PTs that are looking at the way that I look at Adam is I want them to be able to take like one or two pearls away from this conversation for that.
Yeah.
So you've really kind of hit, and not a kind of hit, like you've really done the method in two different parts of our field, which is education and professional sports. Like that's just not, like no one does that. And you're still really young. Like you've still got a lot of years ahead of you also to work. And, I guess you're talking to like a new grad just getting out of school. What is that conversation? I feel like a lot of new grads are like, oh, I want to work professional sports.
Yes.
What are the realities of working for the Red Sox or the Celtics, Super Bruins? Like, talk like what does that path look like?
Yeah, I think people need to understand. I got to Major League Baseball when I was 39. So it wasn't like I came out of school and I was like, all right, here we go. I'm ready to go. Like I had to grind some hours in, and I grind some time in. And I think nowadays you have to realize that hard work, connecting with people. I look at somebody like a Nick Sang, who went to Northeastern, now working for the Celtics, but he grinded when he was in college. He co-opted at the right place. He volunteered at the right place. He did the right things, which set him up to where he is now. They weren't just like, oh, we love this guy, and they probably do, but he worked his butt off to get there. And I think for our students is understanding, coming out, like it's going to take a while. You come out of school, you don't know anything. And I'm a faculty person saying that.
Yeah.
Like I'm teaching these people, but it's the truth. You teach generalists. That's what we do in PT school. That's what you're supposed to do. You come out and you've built a small foundation, and now it's your turn to put up the walls, put in the windows, and then after you put all that up, now you can start kind of fine tuning. And that wasn't until I was almost 40 years old. Which again, I appreciate the fact you said I'm not old, right? But I'm 49, and I'm not at the end of my career by any means, but I've done some cool things. But I didn't start. I worked my way up to that. So I think for people, just having patience, learning skills and techniques, and realistically getting good with your hands. Like you don't need the bells or whistles. They're awesome to have, but you need to be good with your hands. And then the second thing I want to say is people. Like that's, there's that. We're in a profession that we deal with people. And you and I was talking about is the life, but like that's one of the most important things. It's hard to teach, some of these people skills. And, I'm realizing now being in academia as the last 10 years have gone on, we've got to start doing that a little bit more.
It's conspicuously left out of PT education.
Yeah.
Sales is also left out of PT education. And what are we doing every day, Al? We're selling ourselves and our services.
Right.
For good, right? We're selling our services to make people's lives better.
100%.
And I think it's so tough to take that 3 years. First of all, there's probably more information than you can even learn in 3 years. Like there's way more information that you need to know as an EBT.
I'm at a school student 2 years.
Yeah.
Like so a school student 2 to 2.5 years now.
And we can kind of dive into that too, because interesting. It's a new program, right?
Well, that school's been around for a minute in different places, not so Nashville and Atlanta, and opening up a new campus in Orlando in a couple of years.
Okay, great. That's awesome. I feel like we can talk about this a little bit, but the economics of the degree are the reason for that shift.
It's no joke.
I question, and maybe this is because I'm old school, I question how you can take our experience that you and I had and jam it into 2 years and make it the same or better. I just don't know how that's possible.
Agreed.
I also don't know how it's possible to pay back 3 years of a dog area, right? Making $80,000 a year.
And that's why you're seeing a shift. I'm not on here to say hybrid programs are the way to go. This is new for me as well. Yeah. But it does allow a little bit of savings. You think about if you're going to a school, if you live in the Orlando area and you can live at home and you only have to go into school, 1 week every quarter or 10 days every quarter, and you potentially can live at home, or maybe you're getting Airbnb where you're not living in Boston, paying for an apartment. So things are a little bit different, with that. But yeah, you look at some of these schools that are 2.5, 3 years, and even 2 years, it's expensive, and it's getting harder and harder because remember, I don't care what anyone says, healthcare is a business, education's a business, and yeah, it is expensive to go to school, and you're right, you come out hoping to make 80, 85, 90 grand, and you've got loans, potential undergrad, and now your doctoral degree.
Yeah, I applaud our field and academia for realizing that the 3-year solution is probably not a perfect fix, because the economics of it don't really make sense.
Right.
And depending on what you do with your degree, right? So I think the hybrid solution could be a great solution. I think that they really need to look at, the other thing that I really think they need to look at is the PT exam. The NPTE, I think that they need to look at that and really think about, if we're going to shift to this 2-year program, what is the bar? Like, what do people really need to know to practice and to rule out red flags? Because I see people, we've had probably in the past 5 years, and obviously COVID affected education a lot, but COVID shifted it to the hybrid model, right? Like people, whether they liked it or not, kind of had to do it on K1 norm, yeah. So I wonder, and I'm not saying that we should lessen our standards to the profession. You can't do that, right? But when are we going to look at that exam and figure out, I've probably had 20% of new grad PTs that have come through that I know have failed that exam the first time around. And I think Northeastern was 99% pass back when we got through.
Yes, definitely the numbers have gone down across the board.
Yeah.
But I think there's people in place. I guess I go the other side of the fence. I think that CAFE and the APTA have, like, with exam and people that are on the, on exam ready and whatnot, I do think that they are doing the work to try to see what's the best for that. But I will say this is where I think that, clinic owners and people that are hiring need to understand is students are coming out as generalists. That's how they're getting taught. They're getting a little bit of everything, and when they come to a place, they go inpatient, those people who work inpatient, they don't give a crap about what you get to the outpatient side. They want you to get inpatient. And same with outpatient, when you're here, not at your place necessarily, but any outpatient facility, that you start thinking about, like, well, you didn't learn this, that, and this. Yeah, you're 100% right. And that's why I always tell every student, like, your learning just began. Like, you literally the foundation is still wet.
Yeah.
Some of it has to be on the students as well. And I think you talk about the exam and you talk about why do students, why the pass rate's that low. I think COVID had a little bit to do with that. But that excuse is going out the window soon here. Like, we can't pull on that for too much longer. So,
well, now it's 25. So you're, theoretically your classes would have entered to 22.
Right, which would have been for most programs that are residential, normal, course of action. So, is it a different type of student coming in? What's the undergrads like? Because sometimes it's not. You have to look back to their undergrad, and do they have a good foundational science? The other thing to think about is there's a lot of schools out there that are getting pressured to have a lot to fill their cohort. So if you're trying to fill a cohort of, and I'm not talking about any school in particular, but if you're trying to fill a cohort of 100 students, and maybe you've got 80 studs or 80 that are super qualified, and then you've got 20 that qualify, they meet the standards, but where did they do their undergrad at? What was their science GPA like? What was their last 2 semesters like? Those are things we look at. Last 2 years, because someone could have a bad first year. I'm not going to fault them for that. They're learning college and learning things, but those are markers that we're seeing in the PT world is, how you do the last 2 years, how you do the last 2 semesters, and also your science GPA. So then you kind of go back. Well, if you don't have a base for that, how can you build on top of that?
Yeah, I mean, and I agree with you. That test trains generals, right? And for me, I'll be honest with you, that test was really hard.
For me too.
And it's funny. We talked about this. Like, the board certification of orthopedics to me was way easier than the NPTE, because it was you had to know you were clear on it, right? Yeah, and you could focus and I work on being highly focused at one thing and then moving on to the next. It was so difficult for me to. So I feel for these new grads that are like, this test is really hard, because it is really hard.
But you got to think about it. Like, you came from an institution where you went 6 years, right? So you had a great foundational science background. Maybe I'm biased because I worked there for 20 years and went there and spent half my life there. But so you had a great base going into your third year of school, which was your first year of PT curriculum. Additionally, I think you see students that come out, you talk about, like, focusing on one thing. They go in there and say, especially post-baccalaureate students, they kind of go in there and say, you know what? I've worked for a year at an outpatient clinic. I know I want to do that. And I'm like, I keep saying, open your eyes. There could be more. Yeah. There's more on the plate. But they're like, no, I want to do that, So when they get these inpatient classes, they get their foregut pulm class, they get their differential diagnosis. They're not as passionate about it.
Yeah.
And so those are parts that doesn't stick with them as much. So like you said, you're sitting for an OCS. You are knee deep in that, and you're living it and breathing it, but you're also fired up about it.
Right. The passion.
Yeah.
The passion factor. Whereas if I sat for an NCS and
you and I would be garbage.
Right? Like, it's just not my wheelhouse.
No.
It's not. I would say it's not something I'm interested in. It's just not when I.
It's like your passion.
Yeah.
I mean, one of the things that I've heard a lot lately as I've been at my new place is, every patient that walks in isn't an ortho patient, right? They could be a foregut pulm patient because they all have a heart and lungs, right? They're a neuro patient. They all have a neurological system. So, yeah, I would be garbage at the NCS, but there's neuro in every day of everyone we're treating. But it's just not the passion. I'm not passionate. I think about when we took cardio pulm with Larry Cahalan. It's a class that was outstanding, and that the way he taught was crazy, and it was awesome because it was just outside the box. I got fired up for that, but it wasn't something I was passionate about to continue to do.
But he was a good teacher.
He's arguably one of my best teachers I ever had, because I just wish that back when we were there, I wish that they were recorded, because I was picking up every third word he was saying, and I was so intrigued. But I wish, I could go back and reflect a little bit more, as the students have now access to.
Yeah, that's pretty cool. And he went fast.
Yeah.
I think that, your role as professor is pretty unique in that, like, I guess what I would ask is, like, do you feel like you can kind of pick out the students that are going to win later in their careers as their students? Like, what are those traits that you find in those students that you see are in perennial, like, winners?
I think there's sometimes you can. Like, you see those people that, I don't need the person that has 4.0. I don't need the person that's raising their hand every 2 seconds, answering every question. But I need the person that, will ask that question like, ooh, okay, like, where'd you come up with that and why? Why you're inquisitive. And those are people that you can kind of see. It's hard. Like, I used to get in first semester, which I love. I love getting around the gate. They're excited about it. And again, I was teaching foundations for PT practice, which was great. And I was doing things that they got their hands on people, they got their hands on machines, and it was like, but they were excited about it.
Yeah.
And so that's a little harder because you think like, oh, this one's gonna be good, this one's good. Then you see them a year later, like MSK lab, and then you start seeing like, okay, my challenge is you think you get to know people, but until you're in a clinic setting with them 40 hours a week, we don't get to know them like that. I might get them for one class and I get a really good rapport with them, and I consider myself like a student type of teacher where I want to, I get to know them, I know where they're from, I know all about them. But I've sent people for co-op jobs and I'm like, I think they're going to be really, really good, but maybe that doesn't translate into it. That's one of the things I do like with the co-op program is you get to get that out. But yeah.
The co-op, are they going to do that at your new?
No, I mean Northeastern, and then maybe there's one other place that does the co-op. It's not really prevalent, but I think ICE is kind of helping out a lot now, where they integrate clinical experiences, and those definitely help.
Yeah, so we host ICE students here from, I think that's called their pharmacy, maybe a couple other schools too. But there's something to be said about, like, the co-op is, you're knee deep. Like, you're doing the job of an aide, or if that's what we do.
I think you're finding now, though, that you're getting a lot, especially the post-baccalaureate students, a lot of them have done that, whether they did an internship in college at a PT clinic, or when they said, hey, I'm going to work for a year in between and got that experience. So listen, I am biased to the co-op because I lived it, agreed that I taught in it forever, right? But I do think that you're seeing because a lot of most programs are post-baccalaureate now, you're seeing students that come out and says, I had a year experience at Concierge.
Yeah.
I got to now do another 6-month co-op at another place, which is still beneficial, but they've kind of already gotten that experience just at a different level.
Yeah, and I think that, it was obviously baked into our program. So it's tough for me to kind of feel.
Yeah.
Because we have, I probably got 25 kids over the years that have come and done the gap year and gone off to school, which, honestly, what you want. That way they know it's for them. That's the other thing.
And sometimes they know it's not for them.
Exactly.
And that's everybody better. Yeah.
Right? Don't go through 2 or 3 years of education if it's not something you really enjoy, can see yourself doing. I think we have an awesome job. I think, how many places can you walk in and just do what we do? It's amazing. Work with people every day. It's
cool walking through walking through the clinic this morning, and I don't know any of your PTs, but maybe it's just because you're here, but they were all smiling. They're all talking. I heard them before you came down. I was listening to them talk to their patients, and just, it is nice to see that, because I think that's a lost trait that we're seeing nowadays, is the style, the ability to communicate and to connect.
Yeah. And so we, as a company, and I see we talked about this a little bit when we had lunch last month, but we've really invested in communication training and culture. We've hired a company from the DC area come up and do culture training on our team, and to really just get people excited about upping their level of communication with their patients and with their teammates.
Yeah.
Because that's something, again, at school, it's like, listen, you have a job to do, which is to train to pass this MBT. You got to pass the test to become a PT. The communication piece is just sort of, it's hard. It's hard to fit that. Where do you fit that in? 2 years.
Right.
That's
what you're talking about. Again, I'm not trying to sell the co-op thing, but that's where co-op is nice. You get that practice. But I think that's where a lot, we hope that students are getting after their clinical rotations.
Yeah. Yeah, 100%. And the feedback that's, you bring the pass.
Yeah. And you got to set them up for success. You got to realize too that, there was a school that I just came from, Johnson and Wales, where we were building in from day one in MPTE prep. Yeah. So they were getting that long way. And then when they get to clinical, they're going to have a 30-week program to help get them ready for the test. So we acknowledge that, listen, we'd love to get 100% pass rate every college I'd work at. That's the goal.
Yeah.
But we also realize that we need to make sure we set the students up for success, whether it's with that. In the previous place I was at before that, we had a score builders course come in and help the students out, during their senior week to get them prepped to, how do you study? And that's the other thing. It's you finish school, it's like, well, I just go back to my MSK notes and start opening them up. No, there's a way to study and what to study. And so, we have to understand that if we can coach our students along in the process, that it's better for us too.
Isn't that kind of like crazy? Like at the end of your program, you're study. It's like, all right, cool. Where were you 3 years ago? 6 years ago.
Yeah, exactly.
Let's go to pro sports. Let's shift for a second.
Yeah.
So, I think about like Donahue and some of the other guys, and many more than I do because you were in the space. What is that like? I hear all the time, I want to work with athletes. What does that look like to you? Like, what does the path look like?
Yeah, and so as I alluded to earlier, like it doesn't happen overnight. So there's, you ask somebody, that started out and it's like, yeah, they were handing out water at first, or they were just, looking and seeing what's happening and taking it in. So I think some of that is putting yourself out there. I think some of that's connecting with people. This world, it's a lot of what you know, but it's a lot of who you know. And so putting yourself out there and getting more people that back you, that say, oh, this person, this person will be good and has a good demeanor and is trainable. But also thinking about there's a lot of sacrifices that happen. You look at the NFL and you people that are working as a physical therapist there, and they're getting to work at 6 a.m. and getting out at 6 at night. And the perk is, they're home most nights, which is great. But that's a grind. That's in there 7 days a week, and their off season, if they're lucky, is 40 hours a week. It's probably a little bit more. And maybe you have to go check on a player who lives in Kansas City, and you're like, all right, you got someone there for 2 days. I have a lot of friends in football, but in baseball is obviously where I lived. I mean, it was a lot of sacrificing, a lot of missing out. I'd get to Fenway at 12:30 and I wouldn't get home until midnight. And then you unwind, you go to bed by 2, which is now foreign to me. And then you're up, you're up at 9 or 10, and then it's like, all right, get a coffee, eat out. It's like, get back to work, so that was, and then you're on the road again the week. And a lot of times you're by yourself. Like, you get back to your hotel room and it's like, all right, but maybe you're now, and say it's the same schedule. And then you're flying overnight. And so listen, I was very fortunate to be with 2 great baseball organizations with the Red Sox and the Cubs. Like, wouldn't trade it for anything. Great experiences, great cultures there, great teams that want to win.
Yeah.
But people need to understand that, like, if your goal is to work with professional sports, you've got to start surrounding people that work with professional sports and pick their rate. Reach out to people and say, hey, how did you get to where you're getting to? What advice would you give me? Because the advice that I give might be way different than somebody that works football, someone that works hockey or whatever it is. And also be okay with getting rejected. Yeah. You got to put yourself out there and volunteer. You don't see that a lot now. You don't see a lot of people that say, oh, I'll go volunteer just to get the experience.
I love that you mentioned that, because I think that's how Ryan gets started. Because he had mentioned he volunteered. Like, I don't know if the Andrews Institute accepted him for his first, but you could correct me on this. But he just literally said, "I'm not taking no for an answer. I'll sleep outside of your building. I'll volunteer, whatever it is. I'll do it unpaid." Like, how many people are willing to do something unpaid?
Ryan did it before that. When he was at UConn, he was volunteering. He was getting his nose into everything he could. When he got to Northeastern, he got with the head athletic trainer and director of performance basketball, Art Horn. He got with him and said, "What can I learn?" Paul Canapé, what can I learn from him? He was a guy that said there's 24 hours in a day and I'm going to use them all. Yeah. And he did well in school, and he had, look at where he is now. He's doing a great job.
But it was planning.
Yes. He planned his next couple steps ahead, and he was like, what do I need to do to get there? And so I commend him. I'll never say anything negative about like how he has got to where he's got to.
Yeah. And I think, you mentioned the grind, right? And it's, I think about when I think about grind, I think about, say, 70 patients a week in an outpatient clinic. That's what I care about. And, that to me, it's what I did when I first graduated, but it got me good. Was it the best care? I don't know. I was a brand new grad.
Yeah.
And it was more than 40 hours a week. So it's probably more like what you would see 55 guys thinking, I got a 40-hour week now. But it got me to become a little bit more confident and competent in the field.
Yeah.
Just being busy. And it's a different tired than it is, training professional athletes. It's just a different, I mean, you worked orthopedics. It's just a different, you might work 12-hour days, might work 10-hour, whatever it is. You're tired. You're using your body. Like physical therapists use their body and when you make your hands and you're a manual therapist like we do here, like you're gonna be tired. It just is what it is. Your hands get stronger, your body gets stronger and become more resilient. And then over time what to treat first and how to kind of hone in on different. You just get better at the job.
I think the stress, I think you add stress in a professional sport to be now you get that mental stress and mental tiredness that, when you get someone outpatient, it's not easy, but someone comes in, it's like, it hurts when I do this. It's like, all right, well, just stop doing that. Oh, okay. Well, I'm a baseball pitcher. It hurts when I do this. I got to do this about 180 times today. I'm like, oh boy. And I'm going to do it again tomorrow. And then the next day you're like, oh, okay. So I think some of that stress too. And then you've got general manager, you've got coaches coming at you, you've got agents, you've got a player that needs to hit certain markers, So yeah, I agree with you that, it's a tiring profession, both not just physically, but also from a mental perspective.
So go more into detail about the difference between treating like a pro player and just a regular outpatient athlete.
Yeah. So you see it, somebody comes to your clinic and let's just say they come 3 days a week. They're coming for an hour, 3 days a week, which is crazy to think about, which is awesome though.
Yeah.
If you get someone comes to 3 hours, there's 168 hours in a week. So you've done it for 3 of them. And you're hoping that they do stuff on their own as well. And if you have someone who's post-op ACL, they're coming in, they're doing their stuff, and you're like, all right, I'll see you on Wednesday, and I'll see you on Friday. Then, they might get discharged before they get back to their sport because insurances don't care that Johnny, the high school player, is playing football. They want him to get back to school, back to function of whatnot.
Yeah, back downstairs.
Right. Be able to do it.
They care about that anymore.
Right. So there's elevators.
Yeah.
But with the professional athlete, the pro and the con is you see them every day or her every day.
Yeah.
So you see them every day, which is a blessing and a curse. Because if you think about seeing a patient every day and you last see them at 11 o'clock tonight, you say, okay, and then at 1 o'clock tomorrow, how you feeling? Like, I just woke up. Like, not much different than I was 12 hours ago. So sometimes professional athletes, I wish that we had the outpatient ortho mindset with them where it's like a day off is okay. But they keep saying, no, if I could do more. And it's interesting talking to athletes sometimes say, hey, sometimes the body is in your brain needs to get the heck out of here. And it's okay. Or having a recovery day. You're fortunate here. You have a huge amount of recovery equipment. Every pro sport, right? You've got everything you need. So it might be a regen day versus strengthening. So I think that's, and also the biggest thing about why it's much easier to treat professional athletes is access and time. I'm not worried about my 3:30 patient coming in. I can spend that time with that person as much as I need to. I'm not worried about billing for certs. So I'm not worried about hitting 4 codes or 3 codes. I'm worried about, all right, I need to work on this, which allows me, it's your knee, but I got to check your ankle. I got to check your hip. I got to check your, how's your lumbo-pelvic doing? So it allows me to do that. You have shoulder pain. How's your hip rotation doing? It allows me the ability and the access to that. So that's the perk of working with pro sports when you're in that environment.
I think you touch on something that is really like a tough thing for new grads. The frequency of direct visits.
Yep.
Right. So you're responsible now for treating somebody 7 days a week potentially.
Yep.
Right. Like most new grads don't even know what to do with somebody 2 days a week, or they think that it's cookie cutter care to do the same exercise on Wednesday that you did on Monday. When in reality, they probably need those exercises, the same exercises for 4 straight weeks before they can demonstrate any sort of, neural adaptation.
Yeah.
So talk to the students about, or talk to our audience a little bit about, frequency and duration of visits and also like your total body approach.
Well, number one, and I talked about earlier, there's 168 hours in a week. We see them for 2 hours a week, right? And out of that 2 hours, my hands might be on that. If I'm outpatient, might be on the patient, maybe for 30 minutes. And that's if I'm lucky. It's probably 20, 25. So you have to a lot of people come to, not a lot, but when I was working outpatient, people come to PT and like, well, did you do your exercises? No, that's why I'm here. And I'm like, you're here for 2 hours. And so try to get people invested into their care, their own care. Usually when you have an athlete come in your doors as an outpatient clinic, they're usually a little more invested than maybe someone who's not, or whatnot. You know better than me at this point, but I think that you got to get them to buy into things that they'll do. Giving a patient 6 exercises to do at home and they hate doing them, like, what are we doing here? Yeah. So I think we have to consider that as well. Like, what are they realistically going to do, and make them an active participant into that, and really putting a lot of the onus on them. So I think, yeah, I mean, it's the same thing with professional athletes. They come in though, right? If I'm working baseball or even rugby now, and I see them every single day, the monotony of it gets in the way. But I do think, my wife's a PT as well. One of the things she said to me like years ago, she's like, quad sets and straight leg raises work pretty good too. You kind of go back to the basics that some of the people just need the basics. If they'll do them at home, that's great. We can do some different things here, but we look at it like cookie cutter, but I look at it like they're mandatory and they're essentials.
I wish that was trickled down more often, because you can't reinvent the wheel in every treatment. But I love the thought process, Adam, of there's 168 hours in a week and you got them for 2, right? So like if I told you, listen, if you want to fix your shoulder, there's 168 hours in the week and I bet you for 3 of them, what are you going to do on the outside of this, right? Like if I bet you for 3 hours a week, I can definitely tell you this, those are going to be the best 3 hours that you're going to push that shoulder pain for. We still have 165 other hours this week that matter too. What are you doing during those hours? And they're going to say, oh, well, like I have family obligations. I got to go to work. I got this, I get that. It's like, yeah, so that's why you need to be here.
Well, you want to lose weight, right? You do a program 1 hour a day for 3 days. Then I go to McDonald's on my way home. It's like, what are we doing here? And the same things with your body. Like, if you want to get better, then you've done it. That's what you talked about earlier, the sales part. Yeah. Like, I don't need to sell them on, hey, I need you here for 6 hours. I need to sell them on themselves. So that way they'd be successful. So when they get here, we can have success.
The transformation.
Yeah.
The transformation. No pain is one thing. No pain is 4 to 6 weeks. But that's going to come back. It's going to come back because 4 to 6 weeks is not a long enough time to change muscle tissue.
Right.
Let's talk about culture. I feel like at Northeastern, you were always the guy that like everybody wanted to be around because you're just like an uplifting person.
I appreciate that.
Talk to me about how you built a winning culture at each of the experiences that you've had.
So I think I use the term a lot, like investing. I want to invest in the students, and I hope that they'll invest into me. So I think, it's a challenge when you have 100 students in a cohort, and that's, we're out at Northeastern and where I'm at South now, it's 100 students a cohort. So getting to know them. Listen, I don't need to know about your entire family, but getting to know that where you're from, what ticks you, what do you like to do? So when a difficult conversation has to happen, I can have it. Nobody loves confrontation. No one says, I love it. But some people, you have to be okay with it. And I think for me, especially, I was at Northeastern for a long time, and it was a play. And even when I was at Johnson & Wales recently, I wanted to make sure that I got to know the students who are right from the jump. And that's why I love teaching the first semester. Get to know who they are, get to know what they're all about. Why are they here? Why are they in PT school? Why do they want to help people? And so I think that for me is in just being myself. Like, I don't really turn on and off. Like, how I am with the students is how I am with faculty, how I am at home. Like, I don't have different personas. I'm not that smart to be able to do that. So, I'm kind of an open book, and I'm pretty blunt to the point, as you've known for a long time now. So I think the students, some of the students don't like it, but a lot of the students appreciate the fact that I'm invested into what they want to do. If I can help them, and they're a student that I'll be, when I left Northeastern to go to Johnson & Wales, there was a couple students that I pulled aside and went, hey, I want to help you out along the way. Like, use me as a resource. Because I see a lot of potential in this or a couple of them.
And there's also something to be said about being, number one, you actually enjoy doing it, right?
Yeah.
You want to reach out because it's you, it's who you are, and you can't fake that, And the other piece on the student side is there's something to be said about just like enjoying, like just being leadable, right? Like being somebody who can be led by an Adam or a teacher or a professor, and like kind of succumbing to that fact, like, yeah, you don't know it all. Like, you're in college for a reason, to learn. That's why you're here, And we call that, I forget what the exact terminology we use, like with lead them up with our culture thing. Okay. But it's essentially like being a great follower. Like that's what you are in school, is you're a follower. You're learning the craft and learning the field. The other thing that when you were talking about that, it made me think of this concept that like Adam Brantley from Lead 'em Up, that culture company that we work with, he has this concept of filling up the bucket, right? And so the bucket, it's like this faint bucket. I have this like picture in my head, and it's all about like developing trust and rapport with somebody and truly caring about like who they are as a person before you then challenge them and say, I need to see you elevate, right? So like you getting to know your students and where they're from and what they're all about helps you then challenge them when they could have scored a 95 on an MS exam and they scored a 70. Instead of them feeling attacked as a person, you now know them as a person. You know that they want to win and they want to do well. And you say, hey, listen, Alex, I know you want to win here and I know you can do better than this. Here's what we need to do there. Instead of him feeling attacked, now he feels like, hey, you have an ally. I have an ally. I don't have a critic.
Yeah. And I think here, I think at a clinic too, it's the same thing. Like a patient walks in, they're new to you. You're brand new to them, and you're going to sit there and tell them what to do.
Yeah.
Like who wants to be told what to do by someone they don't know? So that's why I talk about all the time about like personality and about talking about listening, but being an active participant. That this is, if I'm treating a patient, we're a team at this point. And the same thing whether you're inpatient, outpatient, pro sports, wherever. And so building trust with people is going to enable them to open up and to allow you to guide them, to lead them, to walk with them.
That's huge. You know, it's so funny. I admittedly used to just skip the box in Web PT where I used to write like, what's the patient's goals? You know, what are their goals? I'd write it like, you know, MMT this, you know, range of motion that. And I'm like, all right, whatever, I'll figure it out. About 2 years in, because it takes me a long time to learn, I finally started asking Adam. I finally started asking people, you know, what's the straw that broke the camel's back that made you come in? What made you pick the phone and call it come in? Like, what is the one thing you're really looking to get out of PT? And it took me 2 years. I mean, if I just probably asked you, like, what's the number one thing you need to do in outpatient? Like, just ask people what they want.
Why are you here?
Like, because it's funny, but in school, you're always so like, I got to fix this objective measure. It's like, do that. And it's like, the osmometry is like, none of that matters. And, you know, it's important.
Yeah.
But it's not, it's urgent, but it's not important.
It should help you get to what they want to do.
Yeah.
Everyone that's in your clinic, it's in any clinic right now, is sitting there as a patient. I hope there's a goal. What's your one goal? Oh, I want to get back to skiing. I want to get back to being able to pick my kid up. I want to be able to squat down. Like, there's always that one thing. You hit the nail on the head. The same thing with an athlete. I want to get back on the field. All right, well, we got 74 things to do before that.
And then my favorite second question to that is, and what else? Because there's usually one other kind of, and that might be the mental factor or something a little deeper. Like it might be something personal. It might be like, I want to be more intimate with my partner.
Yeah.
It might be something a little deeper than just something that's superficial. And they're not going to tell you that day one.
Of course not. And that's with a student too. Like, you ask us, I want every student to go to PT school with the mindset that like, I don't know what field of PT I want to go into, what round. But let's be honest, 90% of them have an idea of like, I want to do this, I want to do that, which is fine.
Yeah.
But I also thinking about like, why are you here? What's your long-term goal? And what can you do over the next 2 to 3 years that you're in PT school to get there?
Yeah.
When you're a PT and you have a patient, what's your goal? All right, my goal is this. All right, well, these are the things we're going to do to get there and get them to buy in, because now they see the steps. I remember being an outpatient. I was working in Hingham, and I was at a clinic, and this lady was a construction worker, and she was one of the workers' comp cases that wanted to get back. She wanted to get back to work yesterday, and every exercise I did, it annoyed me. She would ask me, how is this helping me? How is this getting me to where I want to get to? And it annoyed me in such a way that I look back now, I'm like, all right, I get, like, it was so good to be able to say, all right, we're doing this because it's going to help you do that. And she was like, okay. And at the end, she wrote me like this real nice note about, you explained every step along the way, every question I had. I knew you were sometimes probably annoyed with it, but it allowed me to know how am I going to get to the end goal.
You know, and that's just literally communication. So like, when you think about that person, it's just a C. So they're probably like a skeptic. They want to know all the information in order to make, decisions moving forward. And, the different personality types, like the drivers, like you and I are drivers. Yep. We're always going to push. I want to quick. Like, it's funny, our email exchange, if anybody saw our email exchange, is like,
it's transactional.
It's transactional. It's direct and to the point. Because Adam and I have very similar personalities, but we're never satisfied. We're constantly pushing. And I think that's there are going to be patients out there like that. So what I would challenge new brass to listen to in this podcast is like, look up the DISC personality profiles and use that not only for yourself to profile yourself, to give some self-reflection, but also think about what like where your patients might fall in that category, and talk to them the way that they need to be talked to. You know, somebody who needs peer approval is going to take some time before they, just agree to your plan of care. They're going to ask Mary Sue if her physical therapy worked, and how long it took. And then they're going to ask, Joanne, how long their physical therapy took. Whereas if you just told Adam, come in 3 times for 2 weeks, twice a week for 4, and you're going to fix your problem, he's going to come in for 3 times a week for 2. And if it's not fixed, he's going to want to know why. Because he did what you told him to do.
You've alluded to earlier about like communication and talking. And one of the things we're seeing with some students nowadays is like their CIs have to coach them up on, all right, what are you going to talk to this next patient about?
Yeah.
And I never thought about that. I never once thought about like with a patient, like what am I going to talk? Because we can just look outside, like, all right, there's clouds. Hey, it's cloudy today. What do you think about that? Like, it's always something that I can come up with, but I never thought about for some people, it's not that easy.
Yeah.
And I think, especially with the last 10 years, we're seeing a change in that. But the communication is huge, like such a huge piece. You talk about the email, and it's one of the things, especially I'm at a new place now. I actually told all my coworkers, listen, even when I was at Johnson Wales, I'm very transactional on my emails. Like, if I want to know how you're doing, I'll call you or I'll come see you. Otherwise, if I need something, unless I haven't seen you in like forever or whatever, but it's not like, it's like, I need this is what we're going to do, and here we are.
Well, what's beautiful about that is people know what to expect. So we set an expectation.
Yes.
Like, hey, I'm going to be very transactional here. Don't work that you're not going to get an emoji. You're not going to get a smiley face. You're also not going to be, you don't need to read me as being pissed. Yeah. Antonation.
Exactly.
Like, it just is what it is. And I think that's another phase. Like, people know where they stand. That's a really important thing.
Right.
If you could give every clinician an outpatient practice, I mean, we could say outpatient, or we could say just in general practice, one old piece of advice to elevate their care, what would it be?
So I remember when I was on clinical, the PT, and I talked to this clinician, and I said, what advice, I asked that question, what advice are you giving? He said, for outpatient, inpatient, whatever, origins, insertions, actions. You can know every muscle, every origin, every insertion, every action. You can do anything. And I was like, okay, whatever. And I started thinking more about it. I'm like, it's so grassroots level, so base level, but I'm like, all right, if I know all that, I can do a lot of modalities. I can do a lot of active release techniques. I can do a lot of manual, because I'm like, all right, that's going to affect it. That's going to pull on here, which is inversely going to, affect that. And that was like, for me, was super big. But now that I've, I'm almost 50, looking at, all right, if I have someone come out of school who's 25, and what can I give them? I think now it's, the communication and sales part. And listen, I'm not trying to sell you on 4 codes and I got to keep you here for 2 hours. I'm trying to sell you on like me as a PT, me as a person, that I'm in this with you. And so that communication piece, which again, isn't taught in school, because I think we just assume that that's not people skills, right? You know how to do that. So I think practicing talking to people. When I was at Northeastern, I led what's called, they do these short-term study abroad programs. So I did this dialogue of civilizations. I would bring 30 students to South Africa. And I took those words very literally, dialogue of civilizations. So you can listen to me sit and lecture you, but we're in South Africa. Why would you not want to talk to South African people that know the culture, that know the healthcare system, that know everything over there? And there was a lot to be over the last, when I brought students in 2011, 12, and 13, 14, to when I brought students in 2023, definitely a shift where the students in 2011, 12, cell phones are, they're putting them away. They're all talking, they're all interacting. That's changed. So I think now for students, I would definitely recommend like getting good with talking to people, getting good about, selling people on why PT is important, why we're going to lead you to the goal, how we're going to get to those steps. Because when you go to PT school, what's the goal? The goal is to graduate and pass the MPTE. But along that, I'm telling you how we're going to get there. Well, we're going to take this class and this class. You're going to do your ICE. You're also going to do 32 to 36 hours of clin ed, which is going to prepare you for clinical, but also for, interacting with people. If we're going to do inpatient, we're going to outpatient, we're going to let you pick one. So they know along the way, they get to PT school, they kind of know their mini goals along the way. And then within each course, right? Well, there's this goal and that goal and this goal. Okay, I get through cardiac column, now I'm on to whatever.
There's a map.
Yes.
And then what happens when you graduate?
There's no map.
There's no map.
And there's no one to push it. Yeah. So that's what I'm saying. You look at, and I've talked about Nick Sang, Ryan Donahue. Those are 2 people that, again, I feel comfortable talking about because I know them and I've seen them, but they created the map and they had people help them. They reached out to people and said, hey, so-and-so, how did you get there? What was the route you took? Or, hey, and they made their own maps. And they might have went off road a little bit, but they got right back on because they had people in their corner.
You know what's beautiful too is just, I mean, I'm sure people have asked you for help throughout the years.
Yeah.
It's a beautiful thing to be able to give help. You know, I think people don't realize that. It's like, I don't get nearly as many requests as I should for like, can you help me? Can you write this letter of recommendation? Can you do this for like, just ask. That's half the battle. It's just, I could say no, you could say no, but there's something about giving that makes people feel good. So like when you're young, I expect to be asked. You should expect, I mean, you expect to be asked, and I'm sure you would have been, but you know, I think that don't be afraid to ask people who are where you want to be for just advice or for mentorship or any of that. It's crazy.
I tell a lot of students that that'll come, hey, I want to work post-sports. All right, so well, look people up on LinkedIn. Ask them just for 15 minutes of their time on a Zoom call. Don't ask them, hey, I want a job. Don't ask them, I want an internship. Don't ask them for anything. You just want to know, how did you get to where you got to? That's it. And you know what? That, and some of these people, that might like start a relationship that you never knew you had. Or that person says, hey, you know what? No, go kick rocks. I'm not going to deal with you. And that's okay too. Like, you still put yourself out there a little bit.
Or go show up to a conference.
Yes. And again, I think that's where we talked about early the finances, right? Because PT school is expensive. Some of these conferences, but I'm telling you, for students, they're not that expensive. Yeah. And just to network. One thing that I love about the school I came from, Johnson and Wales, is that every student went to the APT of Rhode Island conference this past week. That's great. And it was, whether they want to be involved in APTA or not, Johnson and Wales is providing them that opportunity for the 3 years they're in school. And then, you know what, when you get out of school, maybe you're then, wow, like, because when most students, APTA, it's extra stuff. You don't see a lot of students doing it. But if we can expose them and then they can be through it and then make the decisions, I think that's important. And so, like you said, go to conferences, meet people. And I also think one thing, a piece of advice I want to give for students that ask for recommendation letters, always ask if that person will write a positive letter.
Yeah, that's a good point. Have you done some negative ones?
I've never done negative ones, but I've done the old, when asked, Sean will do this. So if you read between the lines, it'd say like, oh, maybe Sean's not really a self-starter, you know? Yeah. So that's the other thing that students need to realize is that I think students are afraid to get rejected, afraid to hear the word no. And so, or Sean doesn't have time for me.
Well, they make those are excuses.
Yeah, I mean, I can make excuses.
Or you tell yourself
100%. So I think students need to feel, hopefully people feel comfortable. And if you genuinely don't have the time to do it, saying, hey, I don't have the time to do it, or hey, maybe there's better people. There's people that have asked me letters and said, hey, I want to ask so-and-so instead. Yeah. Because maybe they'd write a better letter, a more favorable letter than I would.
Yeah. Which is the honest truth.
Yeah. And that, it's interesting. At my new gig, I'm the director of admissions for PT, and Johnson Wales, I was running the admissions for the most part, and I've seen a lot of recommendation letters over the last couple of years, and even when I was at Northeastern, we were reviewing applicants, but really in the last 2 years, did a lot of rec letters, and well, first of all, AI is doing half of them, which is fine. I mean, but it's you're having a student ask a biology teacher from freshman year college who had that person for one, and they're just putting their grades in there. And that's tough, but I wish that they would get somebody who saw them in the clinic, because that's more valuable for me. And so when, I saw Sean in the clinic and this is what he did, he would ask questions. He was great with patients. I'm like, oh, this is a person who I'm excited to see them come. And that was what was cool about Johnson and Wales, is that starting a new program, I reviewed all the applicants. And then when they came to life, you're like, oh, all right, the paper's matching the person, which is kind of cool too.
Yeah, that's neat.
Yeah, it was cool.
I think I want to go back to the map piece and we'll wrap up. But I think that the map, I think it's important to get experience across the fields. I'm sure like you, I worked home health, I worked in skilled nursing, I worked in hospital settings. I've done everything, for the most part, other than probably professional sports. Yes. I think that's maybe I appreciate the different kind of aspects that our field has to offer. I think it's important that when you graduate, you should try out the different aspects of our field. At least take a per diem job or do something you never know what you're going to like, and I think putting together that map, I think for pro sports probably looks a lot different than what my path was. I mean, it definitely was a lot different, but taking a day just to think about where you want to be in 10 years and then moving toward that slowly but surely, finding the people to communicate with and to start building relationships with. And it's about quality, not quantity. Like you go to these networking events or whatever, it's like, you don't need to meet 50 people to have a successful night. You need to meet one to start developing a relationship. And it's not going to happen over a weekend. It's going to happen over time.
Yeah, well, exactly. I think, I have the opposite kind of where I didn't do anything else besides traditional outpatient clinic. But ironically, my favorite clinical rotation was my inpatient because it was so foreign to me, and I went all in. And I'm like, this was unbelievable. But I had already been halfway through my career of athletic training. I'm like, I can't leave sports now. But I really enjoyed it. I really enjoyed going to someone's room and say, okay, I got to convince them to get up out of bed, and to do stairs today so they can get out of the hospital. So I'm going to sell them on a different way to get some function to get out of the hospital versus with athletes. It's like, all right, I got to sell them on let's do this stuff because it's going to help you get to the next level or whatever you want to do or get you better, whatever. So, I'm glad that when I got out of school, I did a lot of the outpatient clinic and I saw a lot of different populations, older population that I needed to see, the reps I needed to get. I don't see total knee replacements right now. I don't see, tolls because I'm with healthy athletes for the most part. But to get that experience when I came out of school was invaluable for me, to have that. And I think when you talk about home health care, you talk about nursing homes, you talk about that, and you finally realize that, hey, I got you. Whether you liked it or not, you pick something up from each of those and put it, but you realize where your bread and butter is and what you wanted to do and where you are now. And so for me, I think being a non-traditional student, I look back to school and it was a couple of us that were my age in the class and we were all athletic trainers or working full time. And one of them had a wife and 2 kids and it was crazy, but it was, we were kind of already in our career. That really helped us propel our careers. Yeah. But yeah, that's why I think with school, I think it's important that students that when they do their clinicals really invest into it, really say, hey, all right, I'm at a hospital, it may not be what I want to do, but there's something you're going to get out of it. And there's something you can pull from this that's going to be super important.
But that's a personality thing. That's you're going to pull gold from it, from whatever experience you're now.
1,000%.
I had this experience where I had to go to I get sent to Utah for a clinical rotation that I didn't really want to go to. And I'll just be totally honest with you. I wasn't looking forward to it. And it ended up being a really positive experience, when I learned a lot from that trip. And you just never know where you're going to find the gold, but it's out there if you're looking for it. Yeah. I always say, you just got to you got to tune in to channel P, which is the positive channel, and tune out channel N.
But you also didn't go, you went there originally probably saying, all right, I got to check the box. Yeah. I got to check, I did this rotation in Utah, I got to check this box, whatever. And then when you got there, I'm guessing you said, all right, well, I'm here. I might as well go all in.
Right.
And that's with any student in clinical, you're a student, it's 40 hours a week, which is, again, you go in your first clinical in the first week, you're like, oh my God, it's a lot.
Well, because you're 3 hours in classes,
So it's holy crap. And I'm welcome to the real world, buddy. But because that 40 hours is not 40 hours. Because you're going home at night, I got patients tomorrow. What's the hardest day of clinical? First day. After that, what's kind of coming in the next couple of days. That's all right, I got 2 evals tomorrow. I need to go prep tonight. Now you're doing 3 hours. We hope they're doing some hours of prep, whatever. But it's that first week of clinical is always humorous because they're so this is all 40 hours a week.
Yeah, what is this? Yeah, and they see 3 patients.
Yeah, see.
Yes, exactly. No, but that's the shift. We talked about that a lot. I know we got to wrap this up.
You're okay.
The shift from the school literally being in classes 20 hours a week tops to then working 4 years a week in a finite schedule I find it's hard for people.
It's very hard.
And
that's what that's what I love. I love when the students go on clinical for that first 2 weeks and they're just like, how do people do this? And I'm like, you'll get used to it. Yeah. You'll get used to it. Don't worry.
All right. Rapid fire.
Yep.
Your favorite book.
So I've recently read 2 David Goggins books.
Okay.
And
of course you have. That makes a lot of sense.
But you would hope that I would try out like him, but I'm like, wow, that guy's doing 5,000 pull-ups. That's pretty good. I can't even do one. But that guy is just his mindset's nuts. I try to read a lot of when I read, I'll read sports books, usually autobiographies or whatnot. And usually I only read. My wife and I go to Mexico the week before Christmas, so I bring 4 books with me and lock in. And so I got a couple of good ones coming up, but the Goggins books are the last 2 ones that are awesome.
What's one thing that you pulled from the Goggins books that really
mental? Yeah. So one thing that no one really knows about me, I've done 14 marathons. And you look at some of my size, shut up, dude. I'm like, I hate to run. I hate to train. I look like I don't run. So for me, it's like, that was mental. That was going in for a day of work and saying, God, I hope it's not 8 hours today. You know, and that's the thing with Goggins. It's like, he was the power of like, well, like, yes, no, that's not gonna bother me. Yes, I can do that. I can do that. I can do that. And just to see where he came from and what he did, and he's nuts. He's crazy, and he's certified Looney Tune.
Yeah.
But like, what a motivator, and what somebody I look at and be like, wow, he'll never say he can't do it. And he'll try it.
Yeah, if you stop, it'll be your life. Well,
Yeah.
David Goggins say to you.
Yeah, it's so sometimes I think that, and I'm like, I probably should do one more, and I'm like, I'm what about it?
Yeah. What's a mantra that you like to live your life by?
I think I'm just transparency. I think for me, people, you said this earlier, like, trying to people know what they're getting with me. I'm pretty direct. I'm pretty blunt, but you know, I care about people, especially that are in my life. So I think for me, just, you know, I always want to be transparent and communicate, because I think with any business, and that's just how I thought when I was the interim program director at Johnson & Wales, I wanted all the faculty to know what was going on, because I think sometimes when I was a faculty member, I'm like, what's going on behind the scenes? And I think it helps paint the picture a little bit better when they know, hey, this is what's going on. This is where it is. So I think for me, and even this is how I am when I treat athletes too. Like, everyone's on the same page. Whatever I'm telling the coaches, hey, I've told the athlete, hey, I'm going to talk to the coach about this. It is what it is. So I think transparency for me is huge.
That's awesome. Well, this has been great. Thanks, Adam.
No, I appreciate it. This is awesome. It's been great, you know, with reconnecting, and you and I have kind of stayed in touch over the years. But I think what you're doing here, what you're trying to do, and I think this podcast is just, especially for young PT students, like, you know, there's a lot of podcasts people can listen to out there, but, you know, thinking about people that you're having come in and talk and share some of those things, I hope that, you know, PT students will listen.
Yeah, this is awesome. Thanks, Alan.
Cool. All right.